The world has changed. Telemed has become the predominant medical form of appointment, but unfortunately, the laws have not. Stay tuned and find out what providers and you are going to have to do to continue to use telemed for your appointments for your ADD. This video is for sure the people I see in my practice, but also as a model for other people who I don't see as clients who have stimulants and see their providers on a telemedicine basis. Telemed has long had a requirement for face-to-face appointments. This was mandated under the Ryan-Haidt Act of 2008, where controlled substances are prescribed by means of the internet. The requirement was the prescribing practitioner must have conducted at least one in-person medical evaluation of the patient in a 24-month period. Now, certain pharmacies are adopting corporate policies on a much more stringent basis. And in conversation with the DEA, there's not much we can do about that. That's their prerogative to do that. For some of my clients, particularly those in rural areas, their local pharmacy is pretty much disenfranchising them from getting the care that they need. These rules had been suspended under emergency COVID rules at the start of the pandemic, but these rules expired November 1st, 2022. Going forward, providers like myself will need to have a face-to-face appointment. I literally will have to be seeing every person in my practice to do so. The Drug Enforcement Agency has no idea the timeline that will be there for providers to accomplish this. To quote the agent I spoke with, they said that when we find out what the guidelines are, that's when we'll enforce them. Until then, we have no idea either. This includes anyone prescribed psychostimulants such as Adderall, Ritalin, those variants, benzodiazepines, and agents specifically used for sleep. To accomplish this, I am going to have an office format where I use a brief consultation format. If you're not being seen by me as a provider, this is with a billing code called a CPT code that covers a session for 10 minutes. There are a variety of rates for this. The ongoing commercial rate for this billing code for commercial insurance is $90. The reimbursement rates for Medicaid are $31.36. For Medicare, that reimbursement rate is $43.13. This is the most recent data we have on this. Your provider is free to set those rates. But if you aren't a client of mine, and I'll be going into this with more depth with my own clients, you might want to share this with your medical provider who's prescribing your stimulants, because it provides a model for what to do. What I will be doing is I will be using a variety of screening techniques, post-treatment testing that I will be sending out to my clients and having them fill out before they come to that brief consultation appointment. These are for depression, for ADD, and functionality. And this is a good way of checking in with the person. We'll also ask that people get a current medication list. So again, if you're seen by another provider, refer this video to them as a model for what to do in terms of going forward with Telemed. If this has been useful for you, as usual, thump that like button, share it with other people. Everybody seeing providers via Telemed is going to come under this standard. It's important for everybody to be informed about this standard, because your provider is going to have to be within compliance to the federal law. Until next week, this is G.H. Glade for Everyday ADD Coaching. Thanks for sharing this time with me.